Thank you for coming again. We're so excited to have you here today. Can you go ahead and give us a brief introduction?
Yes, Ms. Williams. My name is Dr. Emmanuel Wilkes. I'm a retina specialist practicing here in Columbus, Georgia since 1986. I completed my training at the University of Iowa School of Medicine. But I went, prior to that, of course, I went to Tougaloo College, which is a HBCU in Tougaloo, Mississippi. That's the North Jackson area. From there, after, as I said, I went on to medical school at the University of Iowa, got my MD degree. From the University of Iowa, I went to Harlem Hospital, which is a Columbia University affiliate, and get my residency in ophthalmology. And then I did a retinal fellowship at Columbia University in New York City.
Perfect. So let me jump back. What did you major in for your undergraduate degree?
I majored in biology. However, initially I went to Tougaloo with plans on becoming a lawyer.
Okay.
And so I had two brothers to go to Alcorn State University. The brother next to me sort of convinced me to go to Tougaloo because he said, if I want to do law, Tougaloo College had a better political science department.
Mm-hmm.
However, he continued to urge me to take some biology courses in case I wanted to go into medicine.
Mm-hmm.
So after completing my freshman year at Tougaloo, I decided when I came back to Tougaloo for my sophomore year, I just changed my major to biology. And that's when it all began.
That's perfect. Awesome. So can you tell us what you said you specialize in retinas, right? Can you
Correct.
tell us what that entails? Like what does that mean for our middle schoolers?
So if you think of the eyeball as being like a camera, okay,
Mm-hmm.
the retina would be the inside of the eye. It would be like the film of a camera.
Okay.
And so diabetes affects the retina, macular degeneration, retinal detachments, and other diseases. Even tumors can affect the back of the eye.
Okay. So I'm going to ask you another question that's kind of like off script, but so a lot of our kids, and me too, I've been to an optometrist before, like to get classes and all that stuff. But what's the difference between your field and that?
So an ophthalmologist is a medical doctor, which is what I am.
Mm-hmm.
So we do 4 years of medical school. Well,
Mm-hmm.
we do 3 to 4 years of college, undergraduate. Then we do 4 years of medical school. And we have to do an internship before we start the residency. And then we do 3 years of ophthalmology. So if you want to specialize like I did, that's an additional 1 to 2 years of training. Whereas an optometrist, they do 4 years of college and 4 years of optometric school. So they're not medical doctors, they're doctors of optometry. Now, their training is such that they know basically the same stuff that we know, but they don't get any training in surgery. So they can diagnose and they can, through legislature, they have asked to be allowed to treat certain diseases, and also they prescribe glasses and contact lenses, which an ophthalmologist can do as well. If you have an ophthalmologist that has an interest in that, but that's something that I don't do. But that's the difference.
Perfect. I just want to put it with something that they can relate to. So
right.
What led you to this career?
Well, once again, my brother who is an ophthalmologist, when I was in medical school at the University of Iowa, in my junior year, I consulted him. I asked him what was he doing, and he said, well, I'm doing ophthalmology. And he also threw out ear, nose, and throat. And so then I decided, hey, I'll do ophthalmology. So you can see that he had a great influence upon me. And so that's how I got into ophthalmology, and it's been great.
That's perfect. So what does a typical day consist of in your field?
So ophthalmology is a treatment of diseases and surgery of the eye. So 3 days of the week, I come to the office, 8:30, I see patients. Then until about 12:30, 1 o'clock, I'll take a lunch break, and then I'll come back until 2 o'clock and see patients. So I'm diagnosing and treating patients. On Tuesday mornings, I do surgery. I do retinal surgery and cataract surgery. 2 o'clock in the afternoon on Tuesdays and Thursdays are that way. Surgery in the morning, and then in the afternoon, I'm back in the office seeing patients. On Wednesday morning, I do injections for retinal diseases, which includes diabetic macular edema, diabetic retinopathy, retinal vein occlusions, age-related macular degeneration, wet age-related macular degeneration. And so, and of course, I have to see my post-op. So I operate on Tuesday, I see my post-op on Wednesday, I operate on Thursday, I see my post-op on Friday. And so basically that's how my schedule runs, 5 days a week.
That's perfect. Awesome. So what do you enjoy most about your career?
Well, the most enjoyable thing is that I can restore vision to patients, especially the diabetic patients, or patients with retinal detachment, because diabetes is the leading cause of blindness between the ages of 20 and 74. And so some patients present with blood in their eye, they present with scar tissue, they present with what we call macular edema, that's swelling in the central part of the retina. And so we have the ability to restore vision to most patients to prevent blindness. And then the other part, of course, is cataract surgery, which is, cataract surgery is 99.9% successful. And some patients who have that procedure done, they're just very, very elated that we can do what we do to prevent blindness.
That's perfect.
I think you're muted.
Oh, yes,
okay,
sir. The announcements.
Yeah.
And so what are some challenges that you faced in your role?
Some challenges that I have faced in my role. Well, I would say the most frequent challenge is trying to get patients out in a timely manner so that, no one wants to wait in a doctor's office. And so that is the stressful part of what I do. Sometimes when I have to do re-ops, on retinal detachments, that can be somewhat challenging. So I would say those are the two most challenging things. The other thing, which is the administrative part of running a business, is dealing with the insurance carriers, getting paid for what you do, the reduction in reimbursement. I've always said that if I didn't have to worry about money, I could do this for nothing. But unfortunately, you got to pay the bills, right?
That's so awesome. That's beautiful. So how do you see your career and also your practice evolving in the next 10 years?
How do I see my career and my practice evolving in the next 10 years?
Because our
Uh,
kids, in the next 10 years, they'll be hitting the job market.
yeah,
So how do you think it will evolve for them when they come up soon? How will your company, I'm sorry, how will your career, and how will your practice evolve in the next 10 years?
yes. So what I foresee in the next 10 years is I have a granddaughter who's interested in becoming an ophthalmologist. So she, yeah, so she will be finishing next year at Columbus State. And she says she wants to become an ophthalmologist and she wants to come back and take over my practice. So
That's so
hopefully,
exciting.
yeah,
Congratulations.
well, thank you. And hopefully that will come to pass. And so I'll still be here. I also have a son, a stepson, who is an ophthalmologist. I was hoping that he would come back, but that's not going to happen. So he also went to Columbus State, and he is an assistant professor at Duke in the Department of Ophthalmology.
That's so
So,
exciting.
so that's my future plans for my career as it draws as it comes to an end.
Perfect. So, what kind of person do you think is most successful in your field?
What type of person is most successful? Well, it has to be a person who's very eager to who reads a lot. You got to be an avid reader. You got to be flexible enough to adapt to the changes because medicine is continually evolving. We're learning new stuff all the time. So I say that's key to being a successful ophthalmologist. Because I can tell you, let's say when I started my training, the way we did cataract surgery then, we are not doing it now. It has gotten better, more efficient, smaller incisions. And so you have to be able to adjust to those changes as they become available.
That's perfect. So, what does communication look like in your field?
Communication, I would say communication, you have to be able to communicate well with the patient so that they understand the diseases and the diagnosis and the treatment, because if you can't explain it to the point that a patient understands it, it is less likely that they're going to follow your treatment plan. So that's my goal, is to always try to talk to the patient in a language that they can understand. And then, of course, you have to be able to communicate to your colleagues, because I'm not an island, and so periodically we're going to be interacting with other physicians, other specialties about certain diseases that can affect the eye, especially diabetes. And then we have to also be able to communicate with the insurance carriers so that we can get reimbursement. And sometimes we have to also communicate with Congress so that we can get certain medications approved for diseases. Because, the way we used to treat macular degeneration and the way we used to treat diabetic retinopathy, that has changed. And so all this new technology, new medication has to be FDA approved.
Perfect. So what kind of technology do you use in your field?
In my field, so we have digital photos where we take pictures of the back of the eye. So just as you would take your iPhone and take a picture, now we have that technology digitally. And of course, lasers have always been around. Lasers for diabetic retinopathy, laser for retina detachment, laser for tumors, laser for some cases of macular edema and macular degeneration. So that's one technology. The other technology would be sort of like an MRI. We can actually do a scan, and this technology is called OCT, optical coherence tomography. So, like a CT scan or an MRI scan, we can actually scan the retina and delineate all the layers of the retina. So that's the technology, that's new technology that's been around for now, 10, 15 years maybe. So as I said, in order to be successful, you got to be flexible and agile enough to adjust and adopt these new technologies. And those are some of the new things that I have.
Perfect. So what kind of classes would you recommend for a middle school or a high school student to take if they're interested in your career or one similar?
Well, I would say they just need to follow the curriculum that is whatever is appropriate for middle school, for high school. And then once they get in college, that's when they want to tailor the types of courses so that they can get into medicine, because it's one step at a time. You got to get the best grades that you can get. So, they talk about STEM, science, math. Okay. Those courses, I would say, would be the ones that they can concentrate on. And if that's offered in middle school and high school, but you really, really begin to hone in what you need, what you should need to get into medical school in college. Now, you don't necessarily have to be a biology major to get into medical school. There are just some basic courses that they want you to take, such as math, science, physics, and chemistry. What medical schools are looking for is a well-rounded person. And, of course, you got to have the grades, you got to have the recommendations, and they like for you to maybe have done some research.
Perfect. So what final words or words of advice do you have for our students here at Richards?
So my recommendation is simply this. You really, really have to study hard. This is what my mother told me. And so she said, study hard, keep God in your life. And when you become successful, manage your money well.
Mm-hmm.
So I think those are things that are good for anyone.
Mm-hmm. That's perfect. Well, thank you.
Let me just add one other thing. Like I said, I initially went to Tougaloo to become a lawyer.
Mm-hmm.
You got to have that confidence about yourself that you can do anything that you want to do.
Mm-hmm.
And so you see, I was able to pivot and pursue medicine very easily, because I was just confident that I could do anything that I wanted to do.
Mhm.
And so that's so important for anyone who's going to pursue any career. You got to feel that, hey, I can do this. I can do anything I want to do.
Mhm.
And but you got to prepare yourself so that when that opportunity comes along, you'll be ready to take advantage of that opportunity. Because when I went to college, finished in 4 years, finished medical school in 4 years.
Mhm.
I didn't skip a beat. I was just rolling and ready to keep going. And so if I could leave them with any advice, study hard and be ready and to do what they want to do, and realize that you're just as good as anyone else.
Mhm. That's perfect. Well, thank you so much for being here and doing our career day virtually with us. We really appreciate it.
Thank you, Ms. Williams. I'm
Thank
happy to do it. Let me know if you need me again.
Awesome.